nagbabalik ang Doctors on TV. Ayan, Casey?
So before we continue our discussion, we remind our viewers to kindly include your name, location, and your age sa inyong mga text inquiries.
Ayan, mga kasama ha, live na live tayo this morning. Very interesting yung topic natin. Kaya please text us for questions. Nandito yung ating mga very prominent na mga doctors, si Dr. Cristina and Dr. Marc. Ayan, si Doc Casey merong question.
Ayun, Doc. Ask ko lang, paano pag nakakita ka na nagsisisure, when do you call an ambulance?
Pag nakakita ang patient na nagsisisure, lalo kung mga generalized tonic-clonic seizures, yung nangingisay na alam natin, ang una, ipapahiga mo lang siya, lalagyan mo ng unan, papatagilid mo lang siya para hindi niya malunok yung laway at mapunta sa baga. No? Tapos wala kang gagawin, papanoorin mo lang siya o orasan mo. Paglalagpas ng 3 minuto, doon ka natatawag ng ambulance. Kasi karaniwan, titigil naman siya within the next 3 minutes. Sa mga unang makakakita, parang forever siya, parang hindi siya matatapos.
Hindi matigil.
Kasi mangingitim siya, naglalaway. Saka pag first time mo makakita talaga, nakakatakot. So, hindi mo na kailangang yung tiyan, kagatin yung kuko, i-press yung hinlalaki, kagatin yung toes. No need for that. You just have to let the patient lie down. Unanan, kung nasa kalye, jacket or bag, tapos nun, orasan lang. Kung naka-flex na ganyan, no need to extend. Kasi hindi mo siya magagawang ganon. Kung naka-extend, no need to flex. Kasi chances are, hyper-excitable yung katawan eh. Hindi mo siya mababago, baka mabalian pa. So, tagilid mo lang siya, orasan mo, and then be prepared to call the ambulance the soonest possible time na maka-extend siya beyond the 3-minute period.
Ayun pala, Doc Casey. So, dapat hindi pala ginagalaw yung pasyente o yung tao na may seizure. Ayun, mga kasama. So, dapat wag daw magpapanik, sabi ni Doktora. Ayun, sundan lang natin yung panuntunin na yon para hindi natin madisgrasya palalo yung pasyente. Kasi pwede palang mabalian.
Yes. Lalo na yung maglalagay ng
Kutsara.
yung kutsara.
Kakagat yung ngipin.
Maaalis yung ipin. Maglalagay ng towel. Kutsara, yung tongue depressor, walang ganon.
Minsan din yung ibang patients binubuhusan ng tubig,
Oh my
ganyan.
goodness, I
So,
know that.
I think kailangan yung tulad nga ng mga nasabi ni Doktora kanina, you just wait and be ready to call the ambulance kung tumagal yung kanyang mga seizure episode.
Yung
And
concern
don't
ni
panic.
Doc Casey kasi, yung pwede ba, sabi nga nila, address yun na 3 minutes. No? May possibility ba na ikamatay ng pasyente yung epilepsy? Especially Doc Marc, sa inyong kaso na may mga history ng stroke.
Actually, halimbawa kung tumagal yung ating mga seizure episodes, especially mga generalized tonic-clonic seizures, they go into status epilepticus. Sometimes yung status epilepticus would have some effects on the brain. Nagkakaroon ng decrease in blood supply going to the brain, decrease in oxygen supply kasi tuwing nagsi-seizure tayo, nagko-constrict yung mga lalamunan natin, ganyan. Nagkakaroon ng obstruction and other kinds of mortalities related to epilepsy. Sometimes yung halimbawa yung epilepsy-related injuries, fall, ganyan, drowning. So, drowning, ganyan, or halimbawa yung mga ibang mga accidents sa bahay, minsan mga nagluluto, then tapos biglang atake ng seizure na sa lutuan. So, kailangan bantayan talaga natin.
So, Doc, I have a friend, may asthma siya. Kaya lang, with the asthma drugs yata, nag-trigger ng seizure. What other medications that can trigger seizure or epilepsy?
Other medications, well, of
Yes.
course, yung mga illicit drugs that can precipitate a seizure attack. No? There are some seizure medications which can precipitate other seizure types. No? That's why when we treat patients with epilepsy, hindi lang ito kasi parang sipon na bigyan mo ito ng tabletang to 3 times a day, hindi ganon. When we treat a patient with epilepsy, hihimayin talaga namin yung history, itsura ng atake, kailan nagsimula, gaano katagal, anong mga ginagawa bago pagkatapos ng atake. Tapos iti-tailor fit namin yung gamot dun sa kumbulsyon. And it's a commitment, no, of a minimum of 5 years. So naka-maintain ka na ng gamot. So hindi pwedeng, isang linggo lang, wala nang atake. Alisin mo na yung gamot. Hindi ganon, no? So you have to, kaya when we diagnose, it's important that we tell the parents na this is a commitment. And lahat naman ng gamot may side effects din. So, we have to discuss that when we start medications in our patients.
So, doktora, ano nangyari sa friend mo na?
Ayun.
Hindi naman niya pwedeng bitawan yung medicine niya.
Yes.
There
Sa asthma.
are, for adults, sige.
Yes, I think yun pa rin yung treatment for epilepsy is still patient-centered. So, we go on taking the history, physical exam, and choose the most appropriate anti-epileptic drug for the patient. Some of the newer or yung mga previous, yung mga older anti-epileptic drugs would have some interactions with other medications that they take. Pero we still tailor fit, tulad nga na nasabi ni Doktoran, we still tailor fit on what kind of drug or what kind of medication would be the most appropriate for our patients.
What about other endocrine conditions like diabetes po ba? Pwedeng mag-cause ng seizure or hormonal imbalance?
For example, yung mga, let's say, mga electrolyte imbalances natin, but nagpo-fall under yun dun sa mga acute symptomatic seizures that we call, but they are not epilepsy per se. For example, tumaas yung sugar, umabot ng mga 500, 600, ganyan, yung kanyang mga sugars, then they can present with seizures, bumagsak yung sodium natin, yung mga electrolytes natin, to some extent nagkakaroon sila ng mga seizures. So, but these acute symptomatic seizures are reversible naman once you replenish the lost electrolytes or once you corrected the offending material.
So, how do you live with seizure, with seizure, like with epilepsy? If you have history of epilepsy, how do you live with it? Can you drive, or do you advise the patient na mag-drive, or dapat lagi may kasama?
Well, when it comes to medyo it's quite a difficult matter to discuss. Pero may tinatawag tayo na seizure-free intervals. Dapat yung seizure-free intervals natin should be long, in such a way na safe yung driving natin. For those who are yung mga professional, halimbawa yung sa mga truck driving, they are not encouraged to do driving. So it's quite
life-changing.
yeah.
It's important to have good
Yes.
seizure control. No?
Yes, yes.
Driving is not a very difficult issue for pediatricians. It's a more difficult situation for adult neurologists because sa amin, syempre hanggang 18 lang kami, hindi pa kami magkaka-driver's license. Pagdating sa kanila, doon na yung medyo touchy topic because of course, any person naman who would like to be independent would like to drive, and driving is truly an issue.
Wow.